Well, good morning and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, January the 12th, 2022. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health Dr. Eileen de Villa, and Toronto Fire Chief and COVID-19 Incident Commander Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good morning. Well, we have many responsibilities as a city in addressing the impact of the pandemic. None is more important than getting as many people of all ages and in all parts of the city vaccinated as soon as possible. More than 6.1 million vaccine doses have been administered by Team Toronto so far. And while most of the doses delivered right now are third doses or kids' doses, some people are still getting their first doses, and this is a good thing. Our city-run clinics delivered more than 100 first doses Monday, among the more than 4,300 total doses administered on that day. I'm glad that Team Toronto worked to build a strong vaccination network so that we can help keep getting people their first and their second and their third doses. Thank you to everyone who's made the right decision and been vaccinated so far. The vaccine, as we know from all of the evidence from our own sources and all around the world, it helps protect you against COVID-19 and the Omicron variant. And if you do get sick, it will help to continue to protect you from the worst of the virus. You're less likely to end up in hospital, and you're less likely to end up in the ICU. And these are very important scientific realities which speak to the more active spread of Omicron and the fact that the vaccination helps people be less sick, if that's a concept which is important for those individuals, but also for our collective health and for the management of stress on our healthcare system. Beyond protecting yourself, getting vaccinated will help bring the pandemic sooner to an end, and I believe that is something that everybody wants. Our Team Toronto efforts to make sure everyone, everywhere in our city are vaccinated are continuing nonstop. Following the success of Toronto Vaccine Day and Toronto Kids Vaccine Day, I'm excited to announce that Team Toronto's next major vaccination event is Vax the Northwest. On Sunday, January the 23rd, Team Toronto will be taking to the court at York University's Aviva Centre, home to Tennis Canada and Canada's premier tennis event, the National Bank Open, with a mega vaccine clinic. There, at the Aviva Centre at York University, the Vax the Northwest team will offer the Grand Slam of vaccination opportunities with first, second, third, and kids' doses of vaccine all available on that day at that time. The team will be able to vaccinate at least 1,000 people between 11 in the morning and 7 o'clock at night. And this is Team Toronto in action, working with UHN, Humber River Hospital, and Black Creek and Unison Community Health Centres. Northwest Toronto was prioritized to reach neighbourhoods with vaccination rates below the city average of 87% for people 12 and older having received 2 doses of vaccine. Team Toronto is working tirelessly to raise vaccination rates across the entire northwest of the city to help blunt the spread of COVID-19 and the very transmissible Omicron variant. We're working with community agencies, with established COVID-19 vaccine engagement teams, and with the on-the-ground ambassadors that we've had deployed across the city to promote vaccine, the benefits of vaccination, and to deal with issues of hesitancy that may be in the minds of some people. Vaccine information is being made available in Spanish, Italian, Vietnamese, Tagalog, and Russian for this event in the Northwest and for our overall campaign in the Northwest. These are languages widely spoken in Vax the Northwest's target area neighborhoods in the northwest of the city. As with other Team Toronto events, we're working with our partners to ensure an easy and fun vaccination experience, especially for the kids, but for everybody involved. More details about Vax the Northwest, the clinic and the event itself on January 23rd, including ways to book appointments, will be shared in the coming days. Look for details on social media using the hashtag VaxTheNorthwest, and as always, you can find information on toronto.ca. Our work to support the province and school boards' return to in-class learning next Monday is also continuing. Team Toronto opened 2 city-run vaccination clinics specifically for education workers this past Sunday to provide first, second, and third doses. More than 1,100 vaccines were administered to education workers at these clinics this past weekend. We'll be hosting 2 more city-run vaccination clinics with appointments specifically for education workers this Sunday, January the 16th. School boards are working closely with the city to schedule employees for these vaccination appointments. Team Toronto and Toronto Public Health also continue to administer vaccines at school-based clinics for students, for their families, and for education workers. More than 29 school-based clinics have been held since the start of the new year, with more clinics planned over the coming days. Toronto Public Health is continuing to redeploy staff to host additional school-based clinics for students, families, and education workers in areas where vaccination uptake needs to be increased. The work to protect residents in the city's long-term care homes is also continuing. Fourth dose vaccination clinics are taking place this week in all 10 of the City of Toronto's directly owned and operated long-term care residences. We're making good progress with 3 of our residences almost complete. The Carefree Lodge has delivered fourth doses to 92% of its residents. The Lakeshore Lodge is at 88%, and True Davidson Acres is at 86%. And clinics will continue until all eligible residents are vaccinated with a fourth dose in all 10 of the city-owned and operated homes. In addition to administering fourth dose vaccinations to eligible residents in these long-term care homes, our Senior Services and Long-Term Care Division is working towards a Ministry of Long-Term Care deadline of January 28th for staff to receive their third dose. This includes students, volunteers, and registered essential caregivers. All city long-term care staff are fully vaccinated with 2 doses of an mRNA COVID-19 vaccine, which is in line with both city policy and ministry requirements. To make it as convenient as possible for city long-term care staff to receive their third dose booster, clinics are also being offered on-site in those instances as well. This week, the City and Toronto Public Health will host a virtual vaccine booster town hall for senior services and long-term care staff to discuss the COVID-19 vaccine booster and to respond to staff questions. To improve air filtration and mitigate virus transmission risk in the city's 10 long-term care homes, this week we will receive 220 HEPA filters from the province of Ontario at no cost to the city. And I want to thank the province for these HEPA filters. They're an important part of our overall plans to keep our long-term care residents safe from this variant while boosting their immune response, along with all the other measures that are continuing. And those include strong infection prevention control practices. Residents, essential caregivers, and staff are screened daily and regularly tested. Everyone entering a long-term care home must be vaccinated, and there is a strict adherence to good hand hygiene, masking protocols, and the use of required personal protective equipment. And finally, residents and staff members are cohorted, which means that it allows for a safer social interaction and reduced isolation for the residents during this time when there are no general visitors permitted in those residences. Throughout the pandemic, the City of Toronto has prioritized the health and safety of people experiencing homelessness, living in shelters and outdoor settings, and will continue to do so, especially now in light of the Omicron variant. We have seen the speed at which this variant can spread, and one of the places that I've been most concerned about and most focused on having daily updates is the shelter system. Toronto's shelter system is the largest in Canada, in the largest city in the country, and continues to provide safe shelter to more than 7,200 people every night. From employing physical distancing to rigorous infection prevention and control, providing access to masks for clients and staff, and activating ongoing vaccination clinics, the city continues to take a comprehensive approach with excellent hard work done by our staff in order to mitigate the impacts of COVID-19 on the shelter system and on the people experiencing homelessness. The frontline staff who provide services in the shelter system are dedicated professionals who continue to deliver services and have continued throughout the pandemic to do so, and who, working collectively with our health partners, will continue to do so as they ensure the stability of the system as they have, and to protect vulnerable people experiencing homelessness. The best defense to maintaining a safe environment within shelters and the broader community, ensuring as many people as possible within the shelter system are fully vaccinated. That is the best defense against the threat posed by Omicron and by the virus itself. That is why the city has been working tirelessly in collaboration with the Toronto Shelter Network, Toronto Public Health, and health partners, including Inner City Health Associates, Indigenous health teams, Ontario Health Toronto, local hospitals, family doctors, and community-based healthcare service providers, to prioritize access to vaccinations among people experiencing homelessness and to increase vaccine intake among that population. Throughout the month of January, there are 154 COVID-19 vaccination clinics scheduled specifically for those experiencing homelessness. Toronto Public Health mobile vaccine clinics are held at shelters, 24-hour respite centres, and 24-hour women's drop-ins 7 days of every week. Since May 7th of 2021, the city has administered more than 12,400 doses at 871 shelters and drop-in clinics. Inner City Health Associates has administered another 3,226 doses. And we have a number of initiatives underway to increase vaccine uptake for residents in our shelter system. The city is also currently working to strengthen protection for all frontline staff through the acquisition and fit testing of N95 masks. A 2-week supply of PPE and N95 masks for staff has been sent to both city-operated and service-operated shelters, 24-hour respite sites, and drop-in locations. Mask fit testing work is underway, and the PPE and N95 masks, these supplies will be replenished in 2 weeks again. As shelters are deemed an essential service, a 25-day supply of rapid antigen tests for staff has also been distributed. I want to sincerely thank all of the city staff and homeless sector partners for their continued commitment, dedication, and efforts as we all continue to protect the health and safety of our most vulnerable fellow citizens. We've relied a great deal on the help of partners in this exercise and on their professional expertise and their professional judgment as to the measures that we have to undertake, and we've had no hesitation in undertaking those measures. I hope that my update today has provided some insight into how the city is continuing to confront the Omicron variant. We've tried to be clear over the last several weeks that this Omicron variant is a challenging part of the pandemic, one of the most challenging parts of the pandemic that, of course, as we all know, has gone on for more than 2 years. It's challenging, the Omicron variant is, because it spreads so rapidly, leading to increased staff absences due to COVID-19 illness, isolation, and caregiving for loved ones, and this, of course, means those people are not available to help us to deliver some of the services and has caused us to have to make alternate arrangements. But it is also challenging because it threatens people. It threatens seniors in long-term care residences. It threatens all other vulnerable residents of Toronto, including people who are experiencing homelessness. And these people have been exposed to threats on a number of occasions during the course of the pandemic as the waves have come and gone. We are working non-stop to protect residents and to save lives. This has been our focus throughout the pandemic, and we've had a particular focus on serving and supporting the people who are more vulnerable. That is why we are continuing to roll out vaccinations at world-leading rates. It is why we are now administering 4th doses in our long-term care residences, and it is why we are doing everything we can to make sure that the homeless residents are kept safe and to ensure that where there are deficits in terms of the vaccination rates, for example, in different areas across the city, that we are targeting those areas with very special and focused initiatives to make sure that we bring those numbers up so that nobody is left behind. We will get through this difficult period, as we've made it through tough times before, thanks to the grit and determination of everybody on Team Toronto, and they are doing a superb job. They're doing a superb job under sometimes extraordinary circumstances, and I thank them for that, and I'm sure I speak on behalf of all Toronto residents in saying that. But it's also thanks to the grit and the determination and the understanding of residents who are doing the right thing, getting vaccinated, helping others to get vaccinated, supporting their neighbors and so on, and helping in this overall unprecedented effort to deal with an unprecedented pandemic. I would now invite Dr. Davila to provide her update for today.
Thank you, Mayor Tory, and good morning. Media reports over the last few days have indicated that the province plans to move students back to in-person learning next Monday, January 17th. I appreciate that many teachers, education workers, parents, and indeed many students are eager to understand what this means for them. First, let me acknowledge all of the teachers, staff, parents and guardians, school administrators, and students who have remained engaged and committed over these last few weeks. I have frequently thought about those in particular who parent young children and the dedicated teachers who keep those same young children engaged through online learning. I know that you are often moving mountains to keep learning happen in the midst of so many other pressures. As a parent, I can appreciate that regardless of whether you believe kids should be back in the classroom or remaining in online learning, everyone who parents or cares for a child is weighing the risks of keeping their children isolated at home when engaged in online learning against the risk of exposure to the Omicron variant when children are outside the home. Amongst health professionals, we know that in-person learning is an essential activity to children's mental health and development, as well as their educational progress. At this time, we must all continue to do our part to preserve in-person learning and keep our schools as safe as possible for kids, teachers, and our essential education workers. While education is the responsibility of the province, throughout the pandemic, Toronto Public Health has supported our local school boards and independent schools to implement measures that promote a safe learning environment. Toronto Public Health will continue to support schools by providing guidance for public health and infection prevention and control measures in order to protect students and staff. Things like daily screening for symptoms by students and staff, physical distancing, and mask use, to name just a few. The Province of Ontario released new interim guidance for schools and childcare settings late Monday in order to support in-person learning during the Omicron wave. We are awaiting further communication from the province later today on the new school guidance and will continue to work with the province and local school boards as we receive further provincial direction. Toronto Public Health will continue to focus on vaccine education and providing dedicated immunization clinics for all eligible children and youth, as well as third doses for childcare and education staff. Since November the 1st, Team Toronto has held more than 250 school vaccination clinics across the city. Collectively, we will continue to augment our mobile vaccination teams to continue to bring doses directly to communities, particularly those who require focused efforts and outreach to increase vaccine uptake. Vaccination is one of the key actions parents and caregivers can take to protect their children as they head back to the classroom. And we know that vaccination against COVID-19 is one of the best measures of protection for our community overall. We have a great deal of information and evidence that the Pfizer COVID-19 vaccines are safe and effective for children and youth. They have undergone rigorous testing and approvals processes and have been safely administered to millions of children and youth in Canada and around the world. I know that this is a stressful time for many, but our collective efforts can keep school environments as safe as possible so that children can enjoy all the benefits of in-person learning. I want to extend my heartfelt thanks to the many Toronto Public Health staff and our partners in the healthcare and education sectors who have gone to great lengths to maintain classroom learning throughout the pandemic. To the many parents who have adapted time and time again as the pandemic has evolved, thank you for your patience and for going above and beyond in supporting your children in the midst of so much uncertainty. And finally, to every child and young person in Toronto who has persisted in their studies over the past 2 years. I know this has not been easy, but know that your perseverance and commitment to learning is exceptional, and I want to assure you that we will continue to make every effort to keep your schools as safe as possible. I'll now hand it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. Davila, and good morning. Yesterday, our emergency and essential services operated with an average unplanned absence rate of 13.7%. Between December 23rd and January 11th, our emergency and essential services operated with an unplanned absence rate of 12.1%. Our team continues to implement their mitigation plans effectively, thereby ensuring that these essential services continue to be delivered across the city. From a citywide perspective, yesterday, we operated with an average unplanned absence rate of 7.8% across all of the city divisions. Yesterday, Toronto Paramedic Services operated with 120 paramedic ambulances on the road. This is consistent with pre-pandemic service and staffing levels. This is testament to the continuing commitment and dedication of our paramedics, who continue to go above and beyond the call of duty to provide exceptional care. Chief Raftis continues to work with hospital partners to quickly release paramedics from hospitals so that they are available to respond to emergency calls as very quickly as possible. This important work and these discussions are continuing. Yesterday, Toronto Paramedic Services operated with an unplanned absence rate of 13.1%. Also yesterday, Toronto Fire Services operated with 121 frontline trucks and crews in service. This too is consistent with pre-pandemic service and staffing levels, providing Toronto residents with world-class fire protection performance. Fire services are continuing to respond to approximately 60 additional low-priority paramedic calls each day, where there is no clear indication of a patient or injury. Upon arrival, if a patient is identified who requires the expertise of a paramedic, Toronto Fire Services will initiate patient care and notify Toronto Paramedic Services, who will then respond. This is one of the ways we are continuing to maximize paramedic ambulance availability for high-priority calls. As with our paramedics, I also extend my sincere thanks to each of our Toronto Fire Services staff, who continue to accept shift extensions and overtime shifts in order to maintain in-service capacity. Yesterday, Toronto Fire Services operated with an unplanned absence rate of 10.2%. Each of our other emergency, essential, and critical services, including Toronto Police, Toronto Water, TTC, Shelter Support and Housing, Senior Services and Long-Term Care, Children's Services, and our city-operated COVID-19 vaccine clinics, also continue to provide exceptional service to Toronto residents, and I thank them also. Our entire City of Toronto team continues to do an exceptional job of managing through the challenges associated with increased numbers of staff being unable to report for duty as a result of COVID-19. Our Emergency Operations Centre continues to be fully activated, including the Business Continuity Task Force and the Personal Protective Equipment, or PPE, Management Task Force. Our PPE inventory continues to be in good shape, with supply chain, inventory management, and PPE distribution processes remaining effective. Our COVID-19 Strategic Command Team continues to work every day to ensure that all aspects of our citywide response to the pandemic remain responsive and effective. As the situation with COVID-19 continues to evolve, so will our planning and response. I encourage you to continue to make toronto.ca/COVID-19 your first choice for up-to-date, accurate, and timely information on all aspects of COVID-19 response in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. First up, David Ryder from the Toronto Star. Good morning, Dave. Go ahead.
Good morning, everybody. My first question, I think, for Dr. Davila. Dr. Davila, you talked a little bit about back to school. A lot of parents who maybe are unsure if the provincial plan is enough will be looking at you and Toronto Public Health to maybe fill in any gaps. Other than vaccination, is there anything you can or are doing to help ensure kids are returning safely to the classroom?
So, David, as I mentioned in the remarks, we are awaiting details from the province, and so can better comment on what it is that Toronto Public Health might be able to do once we have those details. You're quite right, though. We are going to continue with vaccination, and certainly I think our school board partners would agree that we've played an important role in liaising with them and in providing supports around the use of public health measures and infection prevention and control measures to reduce the likelihood of transmission of COVID-19 and to protect the school environment as much as possible. So certainly we're going to continue that over and above our vaccination efforts. And we're looking forward to hearing what the province has to say later today so that we can then comment more specifically once we're equipped with that information.
Thank you. I think my follow-up is also for you, Dr. Davila. And is that given the change in provincial direction around the reporting of infections in classrooms and in schools, what has changed for TPH in terms of how it's either tracing school infections, student infections, or how it's reporting those? How is it going to be different than in the past?
Well, David, again, this is one of those things that is going to require the further detail from the province, as they make their announcement later today. There is some preliminary guidance that has been provided, but it's my understanding that further details are coming today and that these details will outline more about what people can anticipate in the schools, on the ground, as they move forward. So once we have details, happy to talk to you and the public further around what the local role looks like. But for now, we're just going to wait and see what the province has to say.
Thank you. We'll go next to Mark McAllister from City News. Go ahead, Mark.
Thank you to Dr. Davila and Mayor Tory. You've spoken at length about the number of clinics that are being set up at schools for education workers and for students. I'm just curious, beyond just setting up clinics and trying to get the word out, the number of students or 5 to 11-year-olds that have been vaccinated to this point is actually quite alarming. You've got less than half of children of that age vaccinated at this point, despite having to go back to school next week. How much more do you need to do to get parents to get their kids vaccinated?
So why don't I start and we'll see whether the mayor has anything to add. I actually see the situation a little bit differently. In fact, we started the youth vaccination campaign in late November, and we have now, in a big and diverse city like Toronto, are approaching 50% of the eligible population 5 to 11 years already having received vaccine. And of course, with many, many more clinics and opportunities for people to get vaccinated in the weeks coming, as you've just mentioned and as the mayor mentioned. We are certainly providing lots of opportunities for parents and caregivers to become educated and to have their questions answered across all Team Toronto vaccination partners. And I think it is actually a remarkable achievement that in a city as big and diverse as is ours, that we have been able to get to that level of vaccination in a few short weeks' time. Of course, we're not satisfied with that. We want to make sure that as many children as possible, as close to 100% as we can get, are going to be vaccinated, and that's why we're continuing all these efforts to make sure that vaccine is as available as possible to those who have yet to receive it. And in particular, we're focusing efforts on those neighborhoods where we know there are more challenges, and there have been historical challenges in respect of uptake. We have a variety of community ambassadors and trusted community leaders who are helping us in this regard as well. And as far as our school-based efforts are concerned, we have nurses who do and have been doing vaccine education and promotion as well within school communities. So that's just a sampling of the kinds of efforts we're going to make sure that we get as many children vaccinated as quickly as possible. Mr. Mayor?
Can I just underline one point Dr. Davila made and expand on a second? The point to be underlined is that we have achieved about 50% vaccination of these kids 5 to 11 in a period of time that I think is about 8 weeks. And so in that sense, we're not satisfied with that. We obviously have to go on to do the rest. But I think the second point is the one that really will give a better idea of our focus. That 50% includes an 80% vaccination level among kids 5 to 11 in some neighborhoods that tend to be in neighborhoods that are more well established and well off, and rates that may be 25 or 30% in some of the areas where we've had more difficulties with accessibility to vaccination, with hesitation and so forth. That is why that the efforts that we're undertaking today in the schools, in the community, even something like Vax the Northwest, these efforts are very much targeted to getting the vaccination rate up in those neighborhoods among kids and among residents generally. And we are leaving no stone unturned in our effort to do that, recognizing as well another point that Dr. Davila made. This city is a much more challenging place in which to achieve those high numbers because of its diversity. It's diversity in every single respect, and it just means that the local approach we've taken to addressing each neighborhood on its own, almost down to street by street and building by building, is something that is very much necessary in order to make sure that we can have the right message, the right ambassadors, the right circumstances, the right timing to get that done. And so while we're not complacent for 1 second, I think if you think of 50% of that group of children achieved in a relatively short period of time, and now with the targeted efforts to push those numbers up, especially in areas where they're very low, we will get the job done. And we're doing it with a special degree of urgency because of the return to school, with the in-school clinics, with the different things that we're doing in conjunction with the province in some cases, but mostly with our health partners in the city.
Based on that, if you're satisfied to this point that it is 50% and you certainly want to get it higher, do you have goals in mind in terms of timelines? When would you prefer to have it at 80% for children of that age?
Well, I will start on this one. In all of our goals, whether we set the 90%, which we're really close to achieving now with respect to first dose, and we're really close to achieving 90% with respect to second dose for adults, we've made huge progress on the booster third doses. We want to get these things done as quickly as we can. But we've also come to recognize, no matter how innovative we've tried to be and how determined we've tried to be, that it takes time with some of the groups to ensure accessibility, to provide the degree of comfort and reassurance about the vaccination. I think kids have added an added element to those who had a hesitation before, because they're talking about their children and they're uncertain about this, and we're working very hard to deal with that. And so I would just say to you that obviously the goal to be at 80% or any other number up to 100 is as soon as possible, and we're working at top speed with all the resources we can muster to do exactly that.
Right, thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hi there, good morning. I wanted to ask, I understand that this press conference is obviously happening ahead of the minister's announcement and briefing later today, but I'm trying to understand whether or not the province has briefed, officials of the province's largest city on their back to school plans. Do you not know the details of their back to school plan, or are you, like the rest of us, waiting to actually hear that later this afternoon? I'm just trying to understand.
Yes, so Jennifer, we have had some opportunity, as have other local public health units, to participate in meetings with provincial colleagues. And I mentioned in my remarks today that, in fact, some interim or preliminary guidance was provided earlier this week. But at this point, there are many details which we understand are coming later today, and we are awaiting those details in order to have a better understanding of what might be anticipated from local public health units on the go forward. That being said, I think it's really important that people recognize that here at Toronto Public Health, for sure, we are prepared to do what we can and to do everything we can to support our local school boards and the province as they seek to return to in-person learning. We have all agreed that this is an essential activity. The science certainly supports that. So whatever it is that we can do at Toronto Public Health to support that safe return to in-person learning, we are ready and willing to do. You've seen us do this through vaccinations, through the advice and support that we're providing at the local level in and around infection prevention and control and public health measures to reduce the risks of COVID-19 within the school setting. And we'll look forward to hearing what the province has to say this afternoon and working with them on what that means for us at the local level.
And just also for you, Dr. Davila, can you help parents understand with the information that you do have at this point? Will Toronto Public Health be able to alert parents to a case in their child's class? And what can TPH do to isolate those cases to individual classrooms, or if there's spread to individual schools? Because up until this point, parents I think I've gotten used to maybe getting those notifications and a child being sent home because there's a infection in their class, and in some cases entire schools being shut down. So can you just help us understand if that is going to significantly change? Is that not a helpful public health procedure in your opinion?
So Jennifer, this is one of those things that actually does require the detail that we're awaiting from the province. You know, understanding what exactly the new world looks like is very much dependent on what we get from the province this afternoon. I think we can all agree, though, that, you know, here we are in a new wave of this pandemic with a new virus, or a new variant, I should say, of the virus. And this will require different methods and approaches. We're waiting to hear more details from the province so that we can better articulate to the public what our role will look like on the ground. But as I mentioned earlier, at Toronto Public Health, we're ready to do everything we can to support that safe return to in-person learning. We recognize that the province and school boards have a big job in front of them, but we're ready to help them in whatever way we can. So, you know, stay tuned, and we'll be ready to help.
Thank you. We'll go next to Sean Leathong from CTV News. Go ahead, Sean.
Hi there. This question's for Dr. Davila also on the subject of schools. I was wondering, can you give us any sense, because, I mean, we're getting some indication from daycares that have not closed that, you know, staffing is becoming an issue. Do you have any predictions for what you may be dealing with next week as far as staff members becoming ill and having to miss work, and then what would be the plan after that?
So Sean, again, one of the many challenges that certainly this new wave of Omicron has challenged all of us with, and this is in every sector. It's not just in childcare or in education. I think it's been in every sector. With a variant that is so transmissible, we are seeing a great deal of impact with respect to the available staff who can work, many of whom can't show up because they're either isolating because they're sick with COVID-19 Omicron variant, or were exposed, or are caring for somebody. So at this point in time, it's difficult for me to predict what is going to happen within childcare. Certainly we're interested, as I've mentioned now a few times, in hearing what the provincial plan looks like, and we're prepared to work with that provincial plan to help support the restoration of in-person learning in as safe a manner as is possible, both in schools and in childcare. We have had a long relationship with childcare here throughout the city. We have a team that provides support to childcare facilities, making sure that they are using the best available infection prevention and control practices and deploying public health measures to good use, to good effect, I should say, and we're ready to continue that work pending the details that we're awaiting this afternoon from our provincial counterparts.
Do you have a follow-up, Sean?
Yes, I do. When it comes to return to school, are you anticipating a high rate of those absences because we know this is so transmissible and breakthrough infections are becoming much more common? I mean, basically, we're wondering, are we in a situation where you're anticipating we could be right back to shutting down within a week or two?
So Sean, again, it's so challenging to predict, what can happen in the next week or two. What I can say is that, of course, as the local public health unit, we are committed to working with our schools and our childcare facilities to do everything we can to help them implement infection prevention and control measures and public health measures to reduce the impact of COVID-19 on the operations of those schools. And of course, vaccination is one of the measures that we are actively pursuing, as you've just heard, as quickly as possible to offer that kind of protection to all those within the schools and childcare settings. So, I wish I had a crystal ball. Unfortunately, I don't. But I certainly can commit to our schools and to our childcare facilities throughout the city that Toronto Public Health is prepared to help them with reducing the impact of COVID-19 as much as we can.
Thank you. We'll go next to Miriam Medahia from Radio Canada. Miriam, go ahead, please.
Hello, my question is also for Dr. Eileen De Villa. It's about LTC homes. Are you observing a rise in the number of cases and deaths?
So I missed the last part of the question, witnessing a rise in
the number of cases and deaths in long-term care homes.
So generally, my understanding is looking at long-term care data, we are seeing a number of outbreaks within the context of long-term care homes throughout the city. And just a reminder that when we're talking about outbreaks, we're talking about situations where there are, 2 cases with a link to the facility. So it may be 2 or more, and it's not always a large number of cases, as the word outbreak tends to conjure up in the mind. That being said, as my understanding is that we are seeing cases certainly amongst staff, more so amongst staff than amongst residents in general, and not seeing the outcomes like death quite as frequently as we're seeing in previous waves. So this is one of the things that we're seeing is the benefit of vaccination, that we are seeing better protection in these kinds of settings, particularly within long-term care homes throughout the city. But of course, we're continuing to monitor that with the administrators of long-term care homes throughout the city and with our other healthcare partners, making sure that not only is vaccination being provided, but also that infection prevention and control measures, outbreak management measures, just good public health measures overall are being deployed to good effect in each and every one of the homes throughout the city.
Thank you. And my next question is for Mayor Tory. As you know, Quebec will be implementing a tax for the unvaxxed. Do you think Ontario should implement the same to help its health system?
Well, first of all, this would be a provincial decision, and what Quebec will do is what they think best for the people who live in the province of Quebec. For me, I have previously indicated this kind of an approach I don't think is best here in the province of Ontario or in the city of Toronto, similarly to what I said about a curfew, which I didn't think was something that was applicable here, knowing it has been done in Quebec. I prefer to look at using the tools we have used, which are things like saying that you have certain privileges that you get if you are vaccinated, like your ability to go into a restaurant when they're open, which I hope they will be soon again, the privilege of going to a music venue or to a sporting event if you're fully vaccinated, as opposed to this other approach. I think this approach takes us down a road that is very challenging. What do you do about people who smoke and who end up in the healthcare system, people who have substance use issues who end up in the healthcare system? And so it's just a road that I think we best not go down at the moment here. That's just a personal view of mine as mayor. And I think we should focus on getting people vaccinated, as we're doing, and on some of these other measures that give people privileges when they are vaccinated so that they have an inclination to want to be vaccinated.
Thank you. We'll go next to Talia Ricci from CBC News. Go ahead, Talia.
Hi, my question is for Mayor Tory as well. I'm wondering, with more than 40 shelters in outbreak and many at capacity, if there are any plans to open additional warming centers with extreme cold expected again this weekend.
Well, we have Gord Tanner with us at the moment, and I'll maybe just start, and then he may wish to pick up on that. We have been watching this each and every day. We are looking at options to have some more space open. Some of it was scheduled to open in any event in the normal course. And we're looking at rigorous measures that we have undertaken with the advice of our professional partners who are helping us from outside healthcare organizations as to how we can look after people in a combination of the isolation hotels, in isolation that takes place in place at some of the shelter facilities and other things we're doing. We've also had the added, complication, if I can call it that, of very cold weather, which has caused us to open warming centers. But we are looking at this every single day, and we have a report from Mr. Tanner every single day that we look at as a group, and we will take whatever measures we have to take to provide for the safety of the people in question, including the extraordinary efforts we continue to make on vaccination, which happen relatively unnoticed in many respects, but I quantified in my remarks the literally hundreds of clinics that we've had to make sure that people experiencing homelessness are given special attention when it comes to getting them vaccinated. Gord?
Thank you. Yeah, Gord Tanner is the interim general manager of Shelter Support and Housing. Gord, anything to add, please?
Yes, thanks, Mayor Tory, and thanks for the question. Certainly, we are continuing to explore options to open some additional capacity. As we look forward to the weekend, it's going to be another very, very cold weekend, and so as we've done throughout this winter, we've opened about 325 beds to add capacity to the shelter system. In addition to that, added some warming centers with another 165 spaces, and looking forward to the weekend, I'm hoping we'll add some additional capacity just to make sure that everyone has a warm place to go this weekend.
Yes, of course.
I just want to say that there are people out there who make various comments with respect to the state of the shelter system and how it's operated, and I will just say that there is a team of people which consists of city employees and many partners that we have from the nonprofit sector and professional health advisors who've helped us to put together as safe an arrangement as we possibly can for the people experiencing homelessness. And I just want to put on the record, those people have done a superb job in extraordinary circumstances with absolutely unbelievable dedication over now what is a 2-year period. And I just want to register that we always are looking at this every day, and you heard Mr. Tanner indicate that we're looking for possibilities for adding more capacity and doing anything we have to do to keep the people experiencing homelessness safe. But the people who are in that sector have worked hard, continue to work hard, and have done an extraordinary job in extraordinarily difficult circumstances over a very long period of time, and I thank them for that.
Thank you, Mayor. Talia, do you have a follow-up?
No, thank you.
Okay, that concludes all our questions then. Thank you all very much for joining us. Please stay well.